Hi, I'm Sarah Bruce and welcome to EHI TV. Today I'm joined by Colin Sweeney, the Director of ICT at King's College Hospital NHS Foundation Trust, to talk about the Trust's IT strategy in the face of the new government. Thanks, Colin, for joining us. Today we can't ignore that the health bill has been published this week. So, Colin, first of all, what's your instant reaction?
Well, I can say that I haven't actually really read it in great detail yet. I've had a skim of it. Essentially, obviously, there's major changes as far as the PCTs are concerned. There's a lot of emphasis about patient choice. I don't see a great deal there at the moment about how information is going to be made available for doctors and clinicians to treat patients, and that is one of the concerns that I would have.
Mm-hmm. And how do you expect it to affect the area that you actually work in and your trust specifically?
Well, obviously, we have relationships with PCTs and the way they commission our services. That's all going to change, but I suspect it's going to go back into the way it was back in 1997 when we had GP fund holders. It seems that GPs are much more the holders of purse strings now. I think, obviously, if there's a lot more patient choice, that involves more use of things like choose and book. I'd be interested to find out how we are going to get information to patients to make that choice. There's a lot of things about outcomes for patients. So again, we need to collect data, we need to provide data to people. So how are we going to do that?
Mm-hmm. And obviously, a lot of the measures that are laid out in the health bill are around efficiency savings and saving the money, the £20 billion that the NHS needs to save.
Yes.
Are you feeling the pinch yet at your trust?
Well, we all have savings targets. Each department has a savings target across the board. There's a 10% improvement plan, efficiency improvement plan that we've had to implement, and that will be the same for the next 3 years. On the capital side, we're fortunate at the moment that we've been given actually an increase this year from previous year, and I think that reflects the fact that we need to deliver a lot of functionality that will improve efficiency. I think one of the things that's been recognised is that IT can actually improve efficiency and effectiveness. So, it's looking good at the moment. I don't know if it's going to be so good next year or the following year.
Mm-hmm. When I visited the Trust, I think it was in January this year, I know one of the key visions is to develop a nose-to-tail EPR as you described it. Tell us a bit more about that.
Okay, well, we've had the ICM product in King's now since 1998, so it's a long time, it's 12 years now, and that originally was an order communications and results review system. We've built on that over the years in providing more functionality around correspondence and documentation. We've implemented a lot of work around referrals and areas such as prescribing. We've also looked at ways in which we can integrate things like PACS and other systems. And in essence, although ICM is the basis of our EPR system, we've built a lot of other functionality on it, but the idea is that the people who use the system will go into it and not know that there are other underlying systems in there and other developments that we've built on top of it. I think at the moment we're fairly well advanced, well, we are very advanced with the functionality we've got, but people are always coming up with more and more ideas.
So you've obviously been able to do this as you're one of the ISOF 7, one of the trusts that signed a deal with ISOF before the National Programme for IT.
Yes.
As far as I know, that contract's about to expire. Can you give an update on the state of play on where you stand in relation to that contract and how's it going to be funded?
Okay. Well, currently the situation is that we have a contract until March 2011, and that contract provides support for our patient administration system, so that's the ISOF Patient Manager functionality. We also have ISOF Clinical Manager, but we've never actually put that into the CSC data centre, and the plan is we won't do that. We'll carry on supporting it locally. So the contract that we're looking at is to carry on using ISOF Patient Manager from the CSC data centre. And I have to say, after a sort of initial sticky patch, CSC actually provide a fairly good service for us. So we want to carry on using that. There are some questions about how it's going to be funded, and there are negotiations going on between Connected Health and CSC at the moment.
So why is it that you're opting to stay, ICM and IPM, and have you looked at, Cerner Millennium, the new model that's been implemented at Kingston and St George's?
Yeah, I think the situation we've got is, as I say, we've had a system in place since 1998, and we've got a lot of functionality in there, and there's always been the question about if we move, are we going to be able to move to something that has got as much functionality as we've got? And from what I've seen of the implementation, certainly in the Cerner and the Lorenzo ones, they don't have the level of functionality. You know, prescribing is not something that they've actually moved forward with any of the sites so far. The level of documentation around clinical noting that we have is not present. The correspondence side of things, all the clinic letters, discharge summaries, etc., aren't present. So we feel that the functionality isn't at the level we want, but when something comes along that does provide that, then I think we will have to move, because the system is getting old. The one thing I would say though, and I make this comment to quite a lot of people, is that the name of the Cerner product always worries me, because it's Millennium. You know, we're 2010 now.
Obviously, challenging times at the moment. What are you looking at to deal with challenging times, improve patient safety and create efficiencies? And, you know, is there anything that you've put in the trust that you're not happy with and you don't think it's benefiting you in a significant way?
I think there are things we've put in which haven't gone as well as we would expected them to have gone. I think what we do with that situation is we review and revise the way we've actually implemented something. We look at you know, whether it's achieved the benefits that we've had, and should we revisit the implementation? Should we stop it and restart it? I think as far as the way we're moving things forward, we're certainly looking at the ways in which we capture data, especially around specialist systems. So we're looking to build a framework, because most specialist systems actually record a similar set of information, but obviously they need to report and audit to different organisations, and they have different data to capture. But generally the functionality is very similar.
Okay, thanks very much, Colin.
Okay, thank you.